Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hey everybody, welcome back to the Namaste Wellness Show. This is actually season 3, where we talk about all things holistic health for the mind, body, and spirit with a touch of cultural soul. Today I have a very special guest. She's actually one of my cousins, Dr. Hazel Green Young. Welcome, Dr. Green, Dr. Young. I'm sorry, Dr. Young.
Thank you.
Okay, thanks for being here today. So you are a radiologist with the University Hospital of Cleveland Medical Center, Department of Radiology. And you've been there since 1992. And you also have 2 scholarships set up with the Michigan State University and also the Meharry Medical College in Nashville, Tennessee, which is a historically Black college known as HBCUs. So welcome.
Thank you.
Okay, so I'm really glad to have you. So first, I want to talk a little bit about, you said that, I thought this was really cool. You said that from high school, you knew that you were science oriented. So tell us a little bit about your background and how you got to be science oriented, or what drew you to science, and how you came to be a radiologist.
Well, my parents were very much focused on us being educated. While we were growing up, they were also in college, so that was interesting to watch. You know, my parents actually go to college while I was growing up. I think it had a different impact than if they had already completed their education before we were born. But by watching them, we got to see how much they valued it, because it was a significant investment of time and effort for them to raise a family while in college.
Right. And not to mention they were raising 8 girls, right?
Right. So yeah, I have 7 sisters, most of whom still reside in Detroit, which is where I was born. So some of what happened with me was following in the footsteps of my sisters to some extent. So my older sister went to Cass Tech, my second sister went to Cass Tech, and when I third one, and then it was my turn. So I didn't even think about not going to Cass Tech. And Cass Tech was unique in that it had kind of like, you could specialize in certain things.
Okay.
So I had an opportunity to specialize in chemistry and biology, which is what I did for the 4 years I was in high school. And I would say at this time, it really was reinforced that I had the ability and interest in science. So after that, I went to the University of Michigan for undergrad, and I was a physics major. I wasn't sure exactly what I wanted to do, but I thought about education, since there were already people, my parents, in education. And so at one point, Howard, my father said, well, you should think about medicine. You know, we have a lot of teachers in the family. We have one of my sisters was in medical school. So I started thinking about medical school. So in undergrad, I applied and started medical school actually before I graduated, because you don't have to graduate, you just need to get the pre-med requirements. And I did that in 3 years.
Okay.
So when I got to medical school, I, took all the required courses, but then towards the end, I did radiology elective. And I really fell in love with radiology because I felt I had an aptitude. Plus, the radiologists seemed to be the happiest doctors I had met.
Right. So why do you think that? I did read that about you too. You said you liked that department because they seemed. So what made the radiologist so happy? What do you think in comparison to the other doctors? Specialties.
I am not sure. I'm not sure. I mean, first of all, a lot of emphasis with the younger generation. They talk about lifestyle. And at that time, radiology was pretty much 8 to 5. They didn't have some of the modalities that they have now. So they did their work in the daytime and left at 5 o'clock like other people frequently do.
Okay.
So that might have been part of it. I think also when you're working face to face with patients on a regular basis, that can be more complicated for a lot of reasons. One might be it's hard for some of us. I think it's sad to work with sick patients face to face,
That
and
makes sense.
sick patients sometimes they need help 24/7. It's not like you can shut your office door at 5 when you're a primary care doctor and go home because they might need some advice or consultation after hours.
Oh,
So
okay.
I think part of it was lifestyle.
Okay, well, that makes sense. Okay. Now let's talk a little bit about your sisters. There were 8 daughters, and all of you are either doctors or educators. So how that's pretty, I'm gonna say that's pretty amazing in the Black community coming up around the time that you all came up. We're talking about the 60s, 70s, and 80s, when there was still a lot of racism, more so than there even is now. And there were limited resources, not as much as there were pre-civil rights, I'll say that. So what was it like growing up African American, becoming doctors, becoming educators at that time? And did you all experience, what was your experience?
Well, I have to say, this is going ahead a little bit, but I met with a professor at the University of Michigan about 5, 10 years ago, and I was telling him about my family, how there were 3 MDs and 5 PhDs.
Mm.
And I sort of had thought, yeah, this is unusual for a Black family. He said, this is unusual for any family.
Yes.
And it is true. It is
Yes.
unusual for any family to have so many high achieving children. So like I said, I think partly it happened because my parents had the emphasis on education, but then also, like I say, kind of the monkey see, monkey do thing, we
Right,
followed in the
right.
footsteps
Yeah.
of our sisters. Now, as far as racism, some of it's racism, some of it was sexism. But
Hmm.
what would happen when I, for example, decided I wanted to go to University of Michigan, the counselor in my high school said I shouldn't reach for that was too much of a reach. So I assume that was because either I was Black and or female. And sometimes I got similar advice from people, whether they were Black or white, who just didn't expect that this was something that could be achieved. Then when I got to Michigan, I said I was going to be a physics major. People were also not very supportive. They're like, oh, maybe you shouldn't take
Pursue that.
physics or pursue that. But I had already had 5 semesters in high school, so I was not intimidated by physics. But our parents were always supportive as we were going through our education. There were times when teachers did things because of race. They would give us grades lower than we deserved, and sometimes my parents would intervene. Some of my own sisters were very good at defending themselves. I was less so. For example, we had a long-term substitute for my geometry class in high school, and the substitutes didn't know much about geometry, so I literally taught the class. But
Wow.
despite the fact that I taught the class, they wouldn't give me an A. They said, "Oh, well, people might think that's not fair," or something like that. I don't know.
Hmm.
So who knows what that was all about?
Wow.
But I have to say, at University of Michigan, I remember like my chairperson, one of my main teachers in physics was very supportive. I was probably the only Black person in the class and one of the few women. If there were other women, I don't even remember, but it was mostly white male engineering students. And he was very supportive. He never made me feel like I didn't belong there, which was nice.
Right. Yeah.
So.
Well, there are always those people. I mean, there's good and bad on, in all cultures, to be honest.
Mhm.
So it's good that you were able to connect with somebody that was supportive of you. In one of your uncle's book, Dr. Robert Greene, I've been interviewing him too. And by the way, Kurt, your cousin Kurt,
Mhm.
wanted me to tell you that Dr. Green's son wanted me to tell you that you were his favorite babysitter. So he wanted me to make sure to tell you that because he said you would come to East Lansing and babysit them whenever Dr. Green and Letty Green were vacationing or something like that. So I had to make a note of that to make sure I told you that.
Oh, well, thank you. I hadn't heard. I didn't know that.
Yeah, well, now you know that. Yeah. So, yeah, and I also wanted to say it reminded me of something in one of Dr. Green's books. He mentioned, I think when he was in high school too, um, his teachers, and this was way before you were even in high school, told him the same thing that, something like they shouldn't aspire in the Black schools, they shouldn't aspire to become doctors or, lawyers or, have high aspirations otherwise in education. So that wasn't the first time. So that was something that was probably very common back then. But like the person you talked to said, I mean, that it is very unusual in any family to have 8 children and they're all very successful doctors, PhDs, educators, medical doctors, etc. So, and I remember Aunt Sadie had a copy. There was an article written about all 8 girls when you all became successful in your careers. I don't know if you remember, there was a news article in Detroit. I don't know if you have a copy of it. I know Aunt Sadie had the copy of it, and I have no idea what happened to it after Aunt Sadie passed. But I remember seeing the article, and I remember Aunt Sadie talking about that.
Yeah, we were, I think, in Jet, maybe in Ebony or something.
Oh, really? Okay.
Yeah, I do have copies.
Oh, okay.
But yeah, I think in terms of how this happened, like I say, I mentioned my parents emphasizing education, getting educated while we're growing. But I also think that the fact that we were surrounded by people who were already showing that this could happen, that this could be achieved, including my aunts and my uncles and my great uncles. I think that we just sort of tuned out a lot of the noise because we knew that this could be done. And it's sad because I would say a lot of people don't have that advantage. If somebody tells some people that they can't do it, that it can't be done, they might believe them.
Right, right. Well, hopefully, things are, well, we know they're a lot better than they were in the past, but, there's always room for growth. And we're continuing to move forward as a culture and as a human race, I would hope. One of the things you also say that there are 2 principles that constantly guide you. And quote, if you see injustice, say something. If you see a cause of racial health disparities, do something. So this is kind of moving into our conversation about what you do as a physician. So you want to tell us when you say, what does that mean to you, that quote?
Well, I am, like I say, a radiologist by training, but I think because of my family background, my father being a minister, a missionary teacher, and being, kind of not too far removed from the major civil rights struggles in the 60s, I think I turned out to be a very empathetic person. I think I'm interested in a lot of things outside of what affects me directly. I care about what's happening to other people. And so at one point with my chairperson, I was tasked with being on the Diversity, Equity, Inclusion committee in my department.
And is this recent though, correct? Recently?
That was about 4 years ago, maybe.
Oh, okay.
4 or 5 years. So I was involved. I really didn't want to be in charge because I didn't think I had any special skill or any training to be in charge of it. But I certainly got to see more of some of the health disparities that exist in healthcare in our country. And for example, I had known for some years, like 30 years, that sickle cell disease could be prevented. And I had brought it up once on a talk show they were talking about, and they said, oh, to prevent it costs too much money. And they were kind of dismissive. But then during this last year, they started talking about cures for sickle cell. So there are currently 2 ways to cure sickle cell disease. And sickle cell disease is a hereditary disease of blood where the blood cells tend, under certain stressful conditions, turn into a sickle shape rather than a rounder shape. And the result is that certain parts of the body do not get adequate oxygen or blood to that organ. So if it doesn't go to the brain, you can get a stroke. If it doesn't get to if you have problems with blood flow to the kidneys, you can get renal failure. You can have heart attacks. You can have infertility. It can affect basically every organ in the body. So when they started talking about the cure, I thought, well, that's good too, because there's certainly a lot of people. I think they estimate 100,000 Americans at least have sickle cell disease in our country.
And this is mainly just, mainly in African Americans.
It's largely African Americans, but it's also very common around the Mediterranean. So you'll see people of Italian, Greek ancestry, obviously Africans or the Caribbean, and even India, places like India. So, but in America, it's largely more common in Black Americans, but whites and Hispanics can also get it.
Okay.
So I've looked at this and I started thinking, there's something wrong with this picture when we're talking about curing the disease, which, like I said, is very important, but there's no discussion about preventing the disease.
Right.
So up to this point, what parents would tell their kids, well, you have sickle trait, and so you can't have children with someone with sickle trait. Otherwise, there's a risk of your child having sickle cell disease. Okay. The trait by itself is much less harmful than having a trait from each parent.
Two parents.
Correct. Yeah. Mm-hmm. So at that point, it's 25% chance of that your child. So when I got involved in this space earlier this year, I realized that some people didn't know their sickle trait status, or one of the partners knew they had sickle trait, but the other partner thought they didn't have sickle trait. And as a result, these people were having children with sickle cell disease. So what I found is that there was just a major gap in education. Most people did not seem to know that you could prevent sickle cell. If you Google prevent sickle cell, places like the Cleveland Clinic, Ohio State, etc., would say it cannot be prevented because it's a hereditary disease.
Okay.
Well, if you have the trait or the disease, obviously you have it, that we can't do anything about that per se. But the prevention part is so that the next generation can avoid, if they choose, having a child with sickle cell disease.
Okay.
So I realized that the first step should be education. And it's not taught in the medical schools apparently very much, and a lot of physicians didn't know about it. And the NIH had an article, a research study that showed that 76% of parents who have a child with sickle cell, they themselves didn't even know that they could have prevented having a child with sickle cell disease. And another part of the tragedy of that, because it's a horrible disease, but the other part that's a tragedy is that a lot of parents, if their first child has sickle cell disease, they elect not to have any more children because it is devastating emotionally, financially, physically for the entire family. You spend so much time in the hospital with your child, and your child spends so much time, it's hard for the child to get educated. Sometimes it's hard to keep jobs, et cetera, et cetera.
I'm assuming the sickle cell itself is covered under insurance, or the symptoms of sickle cell would be?
Correct. So if you have sickle cell disease, Medicaid, Medicare will pay for the care of your child or yourself for your whole life, which means that could be, sickle cell patients typically do not live as long as other people. But whether they live 30, 40, 50 years, Medicaid, Medicare will pay the full cost of all their hospitalizations.
What is the average, would you say the average lifespan for someone that has, I'm assuming that if you have the trait, you might not necessarily ever get the symptoms, but if you marry or if you have a child with someone else that has the trait, that child will automatically have it?
25% of your children will get sickle cell.
Oh, you said 25%.
Each pregnancy has a 25% chance of that pregnancy having a child with sickle cell. Now, I knew a family had 11 children, 8 of them had sickle cell. So that's obviously more than 25%, but it's per pregnancy is what the risk is.
Who did you say this was?
I had a friend when I was growing up who lived in Ypsilanti where 8 of the 11 children had sickle cell disease.
Wow.
So, so to prevent sickle cell, first of all, everybody has to know their sickle trait status. By birth, by law, most people get tested for, the babies get tested for like 30 different diseases, hereditary diseases, whether it's sickle cell, cystic fibrosis, thalassemia, a whole bunch of diseases. So at birth now, it's about maybe for the last 20 years or so, everybody potentially has access to that information. However, the information does not always get passed on to the parents and or to the child as they're getting older. One mother said, "Oh, I knew one of my kids had the trait, but I didn't remember which one." So if she doesn't remember, her child won't have the knowledge that they're the ones that have the sickle trait. So there are a lot of roadblocks to making things work optimally. But like I say, the first thing is everybody needs to know their sickle trait status. And if you're an older person, well, if you're still in the age of having children, but it's been a while since you were born, then you either need to talk to your doctor to find out what it was. The health department potentially has the information. Or if all else fails, you can get a free test like at American Sickle Cell Association and get tested for it. And if you donate blood, sometimes they will test your blood and you might find out that way. But I wouldn't rely on that.
You also said that at birth, do they tell the parent? You said whenever a child is born, no matter where you are, I guess in the US, that they automatically test you for so many hereditary conditions. Is the family aware of this, or?
Oh, what happens is the results, as I understand it, go to the ordering physician, which would be the pediatric doctor or the OBGYN, whoever orders the blood test at birth.
Okay.
And from there, it's supposed to get conveyed to the family.
I see. Okay. So they should know at birth. They're technically by law, they should know, but you're saying that the parent should still ask, correct?
If they don't tell you, you should ask.
Okay.
You should ask what the result of your child's test was.
Okay.
Because both my daughters are under 30, but to my knowledge, I don't even think they were ever even tested.
Oh,
I know the older one probably wasn't. It was probably before they started testing routinely.
I see.
So in Ohio and in other states, obviously, when you get tested at birth, it's more of a screening. So it's not 100% accurate. So within a couple months for sickle cell, if they say you're positive sickle cell, you're supposed to get a follow-up confirmatory test like within a couple months. In Ohio, 41% of the families never make it to that next stage, which means they either didn't get the information or it got misplaced, lost, or something happened to it, which is another tragedy, is that the information was available but didn't get conveyed for whatever reason.
Okay.
After you get the second test, if it says that you have sickle cell disease, then you get referred to an institution for care, because within the first months, if you're not treated with antibiotics, you can die of infection. So some of the children who don't get from the first screening to the confirmatory test have died from sickle cell disease in a couple months of birth.
Oh, wow.
Because part of the way sickle cell works is that when you're born with what they call fetal hemoglobin.
Okay.
And that hemoglobin acts normally. However, after a few months, you convert to your sickle cell hemoglobin, and that's when the problems start.
I see.
Now, if you have, I'm sorry.
Oh, no, go ahead.
I was going to say, so if you have the trait, what they do is they refer you to the Sickle Cell Association of America, sickle cell disease. However, that organization does not teach about prevention by using infertility techniques that I'll talk about shortly. They are more into the place where they tell the mother, well, if your child has sickle cell, tell them not to date somebody with sickle cell.
Oh.
And sickle cell.
When you say prevention, then I'm assuming you're meaning if you find out if you have the sickle cell trait, if you don't already have full-blown sickle cell, you would know that. And the prevention would be to have your partner tested. And if they have the trait, then you know that either you're going to give up having children or find another partner.
Or you can prevent it using the technique that I can explain.
Oh, okay. I'm sorry. I didn't mean to.
No, that's okay. No.
I didn't know if that's what you meant by the prevention.
Okay, so that's what I'm saying. So the old prevention was just don't have babies with somebody with a trait.
Got it.
And so some people feel very uncomfortable on their first date saying, I have sickle cell. Do you have sickle cell?
Got you. Okay.
I think nowadays with these dating and hinges and bumbles and tumbles or whatever they are, that should not be as hard, because if you meet somebody that way, you say, I'm 6'4", I weigh 110 pounds, and I have sickle trait. Looking for
Right,
somebody who doesn't have trait and then go
right,
on with life.
right.
But the way it's been functioning, unfortunately, is people fall in love and then find out after the fact.
Exactly.
And then what do you do? So
Right.
what the rabbis would tell people when they had cystic fibrosis traits, they would say, because some of the Orthodox don't even date, they would say, just don't match with this person. And they don't necessarily tell them why. They say you're not a match, because they would have access to the blood results.
Okay.
In the Black community, like I say, they are not necessarily being advised before they get married by a priest or a minister or something. So they don't have that education necessarily.
Now, let me ask you, do you feel though, when you say that, are you feeling that there is a racial disparity in the Black communities? One of the reasons they're not being informed enough compared to
I
other
I think, for example, what I have heard in Michigan, if you have the cystic fibrosis trait, which is more common in white people, they send you to the university for counseling. And a lot of these patients do get counseled about preventing by visiting an infertility doctor. Like I said, unfortunately, the Black kids don't get sent to the hospital when they have a trait. They get sent to the Sickle Cell Disease Association of America, where they don't counsel about prevention using infertility techniques.
Okay.
So there, to me, sounds like a racial component, perhaps.
Okay.
But also, like I say, some of it's a cultural thing. So in certain cultures, people tend to match, like with the Indian culture, you fill out these data, some of them, and then you ask all these questions. How tall are you? Where do you go to school? What religion are you? What state in India did your family come from? All stuff. And so for that one, it's easier to put all that information, even health information, into that database or biodata, they call it. And then you can avoid falling in love and then finding out that you both have thalassemia or something.
Okay.
So I'll go ahead and explain. So the process to have pretty much a guarantee that your child won't have sickle cell involves genetic counseling and talking to fertility specialists. So what they do is if both people have the trait, they form an embryo through the procedure called in vitro fertilization. That's a process that's been getting a lot of attention in the media recently, because in Alabama, some places they're trying to prevent people from using that technique, because the formation of embryos is something that some people don't feel comfortable with.
Okay.
So with IVF, they can make an embryo. So you make embryos, and then you can test the embryo when it's like at the 8-cell development stage, like a couple divisions. So they have like 8 cells or so. And you can test it for a variety of diseases. You can find out the sex. You can't find religion, but you can find the sex. You can find that sickle cell. You can find out a whole bunch of things. And then if the embryo does not have sickle cell disease, then you can safely put that in the woman's uterus. And 9 months later, optimally, hopefully, they'll have a healthy baby who does not have sickle cell.
Okay.
So part of the problem for some people, the discomfort comes from the fact that if the embryo has sickle cell disease, what do you do with it? So some people are uncomfortable with the thought of maybe, leaving it to not develop further.
Correct. Yeah.
So it requires a lot of motivation and education and knowledge to get to that point, because some people don't plan their pregnancies.
Right.
However, I feel like now that if the information can get out that you can prevent having a child with sickle cell, people might be more motivated to plan their pregnancies. I think before, when the Black Panthers were checking for sickle cell in the 70s or whatever on college campuses, when people thought the only thing you could do with information was just not to date somebody with sickle cell, people, I think, were more fatalistic. They took their chances. They thought 25% chance is not that much. However, if it's your child, that's a big deal. 25% is I say I wouldn't get on an airplane that had a 25% chance of crashing.
Yeah, this is true. That's true. So go ahead.
So the other thing is, so another problem is, besides the education, is that this is an expensive process.
Mhm.
It costs approximately $25,000 to undergo IVF with what they call pre-implantation genetic testing. That's testing of the embryo. So the IVF part costs approximately $20,000. Some insurance companies will pay that part.
Okay.
So the $5,000 for the testing might have to be out of pocket, as they call it. I mean, you may have to pay for that yourself.
Gotcha.
The travesty, I think, is that Medicare will not pay for any of it. Medicare, and this is what makes me somewhat suspicious, is they will not pay $120 for you to have a blood test to see if you even have any hereditary disease.
They won't. Okay.
If you go to my hospital and say, I want to be tested for sickle cell,
Mhm.
the cost would be $120 and Medicare won't pay.
I see. Okay.
Now you can go to the Sickle Cell Foundation, they'll do it for free.
Okay.
But in Cleveland, there's only one.
Oh, okay.
And everybody doesn't live next door
Right.
to this place. It's not always
Oh, I see
convenient.
what you're saying. There's not like there's one in every state or
Every neighborhood or anything
every
like that.
neighborhood. I
Right.
see.
You have to make an appointment and then whatever.
Okay. Okay.
So now while 25,000 sounds like a lot of money, which it is, first of all, some institutions have money to offset those costs.
Okay.
They won't tell you about it if you just pick up the phone and ask them. But if you were to show up in their office, they might at some point tell you that there are funds available to help you defray the costs.
And would you be able to share those contact places for some people that might be listening or watching?
I think if anybody's interested in finding about preventing sickle cell using IVF, they can call any major hospital. I think most major hospitals in America will do in vitro fertilization. I know University Hospitals of Cleveland does, the Cleveland Clinic does, and I suspect it's like that in most cities, that the major institutions definitely will do IVF. Like I say, this procedure has been around for almost 30 years, so it's not something new.
Or just maybe even in terms of the testing.
Oh, the blood test?
Yeah, the blood test.
Okay, so
get
if
that
you
at the health department, your local health department.
like I said, for sickle cell, I know you can go to the Sickle Cell Association of America, or you could talk to your own personal physician. They can write an order for you to get a blood test.
Okay.
Now, whether your insurance will pay for it, it may pay for it, but a Medicare will not pay for it.
Okay, but
Blood
that the test just to find out if you have sickle cell, you say it's about $120.
Well, that's how much it is at my hospital, but some of my friends have looked it up online and see it for a lot cheaper than that.
Oh, okay. Okay. But
So
that
you
would
might be able to
be
get
the
it for a lot
first.
cheaper.
Okay. But that's got to be like the first step. And it just seems like, you don't hear much about, like, I think you were saying earlier, you don't hear much about sickle cell or whether or not it's that there are that many cases anymore. I mean, are there fewer cases than they used to be, or are there more? So
I think, and the head of adult sickle cell at my hospital, we think the number is increasing.
Really?
In Ohio, approximately 200 babies are born each year with sickle cell disease.
Every year?
Every year.
Wow.
And I think the immigrant population of people from Africa and at-risk countries has increased significantly.
Okay.
So both of us think that the estimate of 100,000 people having sickle cell is an underestimate. And we also think that the number of people being born with sickle cell disease is increasing. Now, cystic fibrosis supposedly is decreasing, and I suspect it's because people are aware that you can prevent it.
Okay.
So that's the difference between that hereditary disease and sickle cell disease.
Okay. So, are they doing any type of testing or are there any other preventative measures? Because it sounds like there's nothing there's no lifestyle change you can make. There's no holistic approach you can take, or
I know Black men who only date white women. That's how they think they're going to prevent having a child with sickle cell. But that's
oh, you say Black men and that's the reason?
Right, because some of them have sickle trait and they figure if they date a white woman.
Okay.
And the odds are, yes, they probably will be less likely, but they may meet that occasional white woman who also has the trait. And if she doesn't have sickle cell, she may have thalassemia, and sickle thalassemia is not a good thing either.
Oh, wow.
So between just asking everybody, and the thing is, you can't just ask people because people don't know their trait status, and people may be misinformed about their trait status. I think it should be almost like a driver's license where you can look and see, like on my phone, when I donated blood some years ago, it says I do not have sickle trait. If I
Oh.
go to the American Red Cross webpage.
So you
But
can live, a person can live their whole life then with the trait.
you can, but under certain circumstances, they too can have problems. So for some years now, the NCAA has insisted that all college athletes be tested for sickle trait because if they get dehydrated, et cetera, their blood cells can sickle and cause problems too.
Okay, so the blood itself, and I'm not a medical person. Let's see if I can describe this. So the blood cell can be a normal size, but you mentioned earlier that under some stressful conditions, such as like you're saying, these athletes, if they're dehydrated or whatever, then your cell can begin to sickle and
Correct.
cause other symptoms such as heart attack, stroke. I know I was reading I pulled up a website on sickle cell. They said maybe you have general tiredness, also. So it can be a range of things symptoms that you can have. So one
Right.
of the preventatives could be maintaining a low stress level, right? As a preventative, I mean, if you know.
Well, some of the stressors is different than emotional stress. It's like
Okay.
certain altitudes, like you can't be a fighter pilot or something if you even have the trait, because if you get up a certain altitude, you might start having problems.
Oh,
Temperature, if it's cold, some people move south because otherwise they tend to have some issues.
okay.
There's not, some people try and think that there's some lifestyle choice that you could make or decisions, but that's just generally not going to be very helpful.
Okay.
So, but going back to the cure,
Mm-hmm.
so the treatment, first of all, sickle cell itself can cause infertility because you need blood to your testicles and to your ovaries. And if you have interruption of blood flow and oxygen to those organs, then you end up being infertile. The other problem is one of the drugs that they treated, hydroxyurea, they start frequently in infancy, and that can cause infertility also.
Okay.
So those are two sad things.
Mm-hmm.
So going to the cure for a minute, the two main cures are bone marrow transplant,
Okay.
costs about $800,000. It also makes you infertile,
Hmm.
and you have to have a full-blooded sibling to be a donor, a full-blooded healthy sibling to be your donor. So if you have one child with sickle cell and then you give up because you're afraid to have another one, you no longer can do that as an option.
Mm-hmm.
You can try it, but it's not as successful unless the person's a full-blooded sibling. The newest cure is called CRISPR or gene editing. So just about in the last year or so, they have been doing gene editing to cure people with sickle cell. That costs between 1 to 3 million per person. And that also leaves you infertile.
Wow.
So you have to choose, do I want to have less symptoms or do I want to have my own children if possible?
Mm-hmm. So you're saying to do one of these major cures,
Cures.
quote unquote, would be so that you can have children
No,
or just,
it won't help you have children because it's going to make you
oh,
infertile.
that's right. Okay.
But what it'll do is maybe like when you don't get blood to your bones and your chest or whatever, you have severe pain. They call them crises.
Oh, I see.
So these cures do cut down on the crises. But any complications you have already had from sickle cell, whether it's a stroke or heart attack, renal failure, is not going to reverse those things.
I see. Okay.
So there was a 13-year-old, 12-year-old in Baltimore who was recently written about in the New York Times. He elected to have one of these CRISPR cures. The problem is does a 12-year-old know what it means to never be able to have your own biological children? And, the parents obviously have to make the decision.
Right.
So the other thing is, so this technique that I'm talking about, that's 25,000, that is much less than 3 million.
Yeah, I should say, yeah.
Yes. So I feel that people in the sickle cell community and their allies need to petition the new president, whoever that'll be,
Mhm.
or the current president,
Mhm.
to have Medicaid, Medicare pay to prevent. Because the other problem in America is prevention does not make money for hospitals. Hospitals make money by treating people after they get sick,
Right,
by and large.
right.
So they get money from Medicaid, Medicare if you already have sickle cell disease. But if they were to prevent it, since Medicaid doesn't pay, they don't make any money.
Okay.
But so people need to lobby their governors, their Congress people, etc., to consider preventing. Because if you want to help with healthcare disparities, since 10% of roughly of Americans have the trait, this is a significant part of the population that you could save on, if you want to call it saving on healthcare costs, not to mention the misery and all the other things that go with having a horrible disease.
Mhm. Okay. So you're saying about 10% of the American population,
Black American.
10% of Black American
Mhm.
population gets full-blown sickle cell or
No,
have the
has the
trait.
trait. Have the
Have the
trait.
trait. Okay.
Right.
And what percent of that population
Has the disease.
has the disease?
I think I should have looked it up, but I think it's about 1 out of every 360 pregnancies of babies, Black babies born have the disease.
1 out of about 300. Okay.
65. Mhm.
Okay. So what, I know this is probably a figure. How much do you think it would cost the government? So you're saying have the people to lobby the federal government to have Medicaid pay for prevention. And I mean, I know this is probably a lot to ask. How much do you think something like that would cost Medicaid to pay for prevention?
Well, per person, if they don't have insurance and if they use Medicaid, Medicare, we're talking 25,000. But like I say, you have to contrast with the fact that Medicaid, Medicare will pay 3 million, 1 to 3 million to prevent it per person. So 25,000 is much less than 1 million.
Oh, okay.
Because they're already paying to treat and to cure, and the treatment can be 10 million depending on how long the person lives. So they're already paying 10 million per person for the treatment, and have agreed to pay 1 million to prevent per person.
Oh, I see.
So I think
it would be a savings.
So I think it would be a big savings. In fact, there's some articles. I'm hoping to post one of them on my website that shows that it's a cost saving. And I don't like to talk about the cost savings.
Right. Okay.
Because this is a sensitive issue. Everybody's life is valuable.
Of course.
When you start talking about preventing sickle cell, people are thinking, but like my one friend who has a trait, she says, well, if my parents had done that, I wouldn't have been born. So, so there's a lot of psychological kind of issues involved in this whole process. I said, well, first of all, if you weren't born, you wouldn't have known it.
Yeah, that's true.
But secondly, she only had the trait.
Yeah.
So they might have elected to have her anyway, even though she had the trait.
Right.
But the other thing is,
would you, before you go, would you share your website that people can go to and get this information, get more about this?
Yeah, so I set up a website. I just posted about a week ago. It's been a 6-month struggle, and it's still obviously not optimal. But this webpage is called PreventSickleCell.com.
PreventSickleCell.com. Okay.
Right.
PreventSickleCell.com.
All one word. Yes.
All one word. Okay. And they can go and get more information. And then you put more information up there, it's going to evolve over time once you get it set up the way you want it. Okay. All right. Well, is there anything else? I mean, you shared quite a bit about the sickle cell, and I kind of understand why it was not that something. Now, I'm imagining as a radiologist, you see test results, people that have sickle cell or have the trait and all that, but it sounds like maybe this friend that you had that had 8 children. And they
11,
always,
and
was
8
that
had.
what made you really become interested in learning more and taking more of an active role in getting the word out and asking people to write their congressman or talk to people about having a preventative approach to sickle cell? Because that's something I had never thought about. I mean, I was thinking about, like you said earlier, from a holistic point of view, but right now it doesn't seem like, even from maintaining a stress level, obviously not getting to a point where you're dehydrated or other stress factors, trying to prevent those from happening so that you don't have that episode. Because I do have a family member that does have, and I think I mentioned to you, have a couple children. I think a couple of her children do have sickle cell, and they do have to go in and out of the hospital. And that's why I was wondering, and I know sometimes that environment can be stressful, and if there was anything that can be done to minimize the stress, that might help. So you never knew. It doesn't hurt to minimize stress anyway, because if you think about it, I think the medical community, there's some statistic that says 70 to 80 or 85% of chronic illnesses are related to stress anyway. So, but that being said, do you have any final words or thoughts?
Just have one final thought. I met a woman through LinkedIn who has sickle cell disease, and she
Okay.
had a failed attempt at sickle cell bone marrow transplant, a bone marrow transplant for her disease. It left her infertile, and she still has the disease. It did not help her disease. But she is very much interested in trying to educate people, including Congress, about funding for helping sickle cell patients with infertility issues.
Mhm.
And there's a lot of overlap between what people with sickle cell are faced with when they're trying to have children and with what I'm talking about in terms of prevention. Both of them would involve going to see genetic counselors and infertility doctors and then working from there. So she and I hope we'll be able to work together a little bit to achieve what is a common goal.
All right then. Okay, well, thank you so much for sharing and being here today. I think it's been very informative to me because, like I said, I really didn't know a lot about sickle cell. You don't hear that much about it, but what you're saying makes sense, that anytime we're moving toward prevention is going to help in the long run. It's going to help save time. It's going to help save money. It's going to help save trauma, really, saving people going through the trauma that they go through with that disease. So, all right. So thank you so much for being here, and I hope you'll come back again if you have any updates or new developments around sickle cell. Again, please reach out to Dr. Young on the website. Again, give us that website one more time.
PreventSickleCell.com.
Prevent sickle cell.
And thanks for having me. And September is Sickle Cell Awareness Month. So in each community, there may be opportunities to get more information.
Okay, sounds good. I appreciate the time. All right, so thank you. Thank my viewers and my listeners for being here today. And please stay safe, stay well. Until next time, namaste.
Namaste.